if you are watching this video, you are likely getting ready to or thinking about quitting or reducing smoking. That's great. Quitting smoking is one of the most important things you can do for your heart and your health. We realize that quitting smoking is hard, but medications can make it easier. In fact, research shows that taking medications increases your chances of quitting by as much as 36%. Today, I'd like to share with you what we know about the medications that can help to quit or reduce smoking. Okay, let's jump in. There are two main categories of medications that can support you as you try to quit: over-the-counter medications and prescribed medications. Let's start with over-the-counter medications that you can get at a pharmacy without a prescription. Nicotine replacement, or NRT, is one of the most widely used medications to help people quit. Every cigarette contains tobacco and a variety of different chemicals and tar. One of the chemicals is called nicotine. On its own, nicotine does not cause cancer, heart disease, or lung disease. It is the other chemicals in tobacco smoke and tar that do this. But nicotine is harmful because it is so addictive. For this reason, we know that nicotine replacement is safe and effective to use, even if you have a history of a heart condition. Let's talk about nicotine addiction. Nicotine enters your bloodstream and quickly goes to your brain, causing the release of chemicals such as dopamine that can make you feel temporarily energized, happy, alert, or calm. Soon after smoking, the level of nicotine in your bloodstream starts to decrease, and your brain and body begin to crave nicotine again. You may begin to feel uncomfortable or irritable if you try to resist smoking. This is nicotine withdrawal. When you smoke your next cigarette, your nicotine levels increase again, temporarily relieving the cravings and withdrawal symptoms you are feeling. While you may feel like smoking helps to relieve your stress, it is simply relieving the physical and mental stress associated with withdrawal, which gives a powerful illusion of stress relief. Over time, your body will need more and more nicotine to get that short burst of energy and calming feeling. This creates a cycle of use. Nicotine replacement can give you a safe and cleaner dose of nicotine to help manage cravings. Many people ask why they would use nicotine. To quit using nicotine. Great question! How quickly a substance works can affect how addictive it is. If a substance reaches the brain fast, it is more addictive. Cigarettes deliver nicotine quickly, which makes them harder to quit. But nicotine replacement products work more slowly and release smaller amounts. This makes them much less addictive. So it's easier to stop using nicotine replacement than it is to quit smoking. There are many different types of nicotine replacement. These include patches, gum, lozenges, inhalers, and spray. Let's start with nicotine patches. Nicotine patches come in 3 strengths: 7 milligrams, 14 milligrams, and 21 milligrams. The correct dose of patch depends on how much you typically smoke. As a general guide, we recommend 1 milligram of nicotine patch for every cigarette smoked in a day. For example, if you smoke 1 pack per day, you will likely start with a 21 milligram patch. If you smoke a half pack, then a 14 milligram patch is likely a good place to start. How to use. Apply the patch on a clean, dry, non-hairy area of your upper body, like your arm, chest, or back. Replace the patch with a new patch once every day, usually in the morning, after you shower. Always remove the old patch and throw it out before putting on a new one. Using the nicotine patch is safe and effective. It can also be combined with other forms of short-acting nicotine replacement therapy, such as gum, inhalers, lozenges, or sprays. Let's now talk about nicotine gum. Nicotine gum is not your typical chewing gum. It is meant to be used frequently during the day, during trigger times, and when you are having cravings to smoke. How to use. Chew slowly until you can feel tingling in your mouth. Stop chewing and park the gum between your cheek and gums. After a minute, when the tingling is almost gone, chew again. Repeat this until the tingle and flavor is gone, about 30 minutes. Avoid drinking or eating while using the gum. Nicotine lozenges are a candy that contains nicotine. However, not all lozenges are created equal. There are mini and regular lozenges. The mini lozenges dissolve quicker than the regular, larger ones. How to use. Do not use more than one lozenge at a time. Place in the mouth between the gums and cheek. Move it side to side in your mouth to help the lozenge dissolve. Minis take 5 to 10 minutes, and the larger ones can take up to 30 minutes. Do not chew or swallow the lozenge. Avoid drinking or eating 15 minutes before or while using the lozenge. Nicotine inhaler. This is really a misnomer. The inhaler is not intended to be inhaled, but rather puffed on like a cigar. This is because nicotine is much better absorbed through your tongue and cheek than in the lungs or stomach. It may also irritate your throat if you inhale it. It is not harmful, just less effective and irritating. How to use. Line up the markers of the applicator and pull each end in the opposite direction. Insert the cartridge into the mouthpiece and twist to close securely. Puff slowly. It produces an invisible vapor containing nicotine, which is mostly absorbed in your mouth. Each cartridge lasts about 20 minutes of frequent puffing. However, the cartridge is still usable as long as it doesn't dry out, which takes approximately 24 hours. Nicotine spray. This is a spray that provides a quick response to a craving. To use it, point the nozzle close to your open mouth and spray onto your cheek or tongue. Do not spray towards your throat. You should avoid swallowing for a few seconds afterwards. How to use. Push the button down and push inwards in order to gain access to the spray nozzle. The first time you use this, it will need to be primed by pushing on the button a few times before mist appears. You may need to repeat the priming process if you do not use the device for a few days. As with any medication, side effects are possible, including headache, nausea, vomiting, mouth or throat irritation, and hiccups. If you experience side effects that are troubling you, speak to your cardiac rehab nurse or healthcare provider. Let's now move to the prescribed medications. There are 2 effective medications that come in pill form that people can use. The first one is varenicline, also called Champix. Before we get into how to take this medication, let's review how nicotine works in the body. When you smoke, nicotine travels to your brain and attaches to special spots called nicotine receptors, releasing dopamine, the substance that makes you feel good. If you stop smoking, your brain doesn't get nicotine. That means less dopamine is released, which can make you feel cravings and withdrawal symptoms like irritability or sadness. Champix is a medicine that helps with this. It attaches to the nicotine receptors, which helps reduce your cravings and makes smoking less enjoyable. It also causes a small release of dopamine to ease withdrawal symptoms. How to use. Champix comes in a pre-packaged booklet to help with dosing. Start taking the medication 8 to 35 days before your quit date. It is good to try and set a quit date before or soon after starting this medication. You will take 0.5 milligrams once daily from day 1 to 3. On days 4 to 7, you will take 0.5 milligrams twice daily, 1 in the morning and 1 with dinner, for the remaining 12 weeks. You will take a 1 milligram dose twice daily. Take 1 tablet in the morning and 1 with dinner. The recommended therapy is minimum 3 months duration, even if you quit before then for best chance of success. The side effects that some people experience are often dose-dependent, which means you can take a smaller dose if the side effects are challenging on the higher dose. Please discuss this with the healthcare provider who prescribed you this medication as needed. The most common side effect is nausea. It is best to take your medication after a meal with a full glass of water. This can help. Some people have trouble sleeping or have abnormal dreams. If this happens, you can take your afternoon dose 8 hours from the morning dose, and at least 4 hours before bedtime. People may also experience altered or depressed mood and/or headache. These usually go away with time. Bupropion or Zyban is another medication that can help you quit smoking. This medication is also prescribed for depression. It works by increasing dopamine, the substance that makes you feel pleasure. This medication is most helpful in decreasing weight gain often associated with quitting smoking. how to use. On days 1 to 3, take 1 tablet in the morning. On day 4 and onward, take 1 tablet twice daily. Again, recommended therapy is a minimum of 3 months duration, even if you quit before then. This will improve your chances of success. This medication is not recommended for people with a history of seizures or people who binge drink alcohol. Possible side effects. Some people have nausea. It helps to take the medication with some food. Dry mouth. You can try sugarless chewing gum. Trouble sleeping. If this happens, you can take your afternoon dose 8 hours from the morning dose and at least 4 hours before bedtime. Other side effects that are less common are headache, dizziness, weight loss, constipation, tremors, and palpitations. If you have these, please follow up with the healthcare provider who prescribed you this medication. So, how effective are these medications? Here's what the research found. Nicotine patch plus gum, combined, has the highest success rate at 36.5%, followed by Champix, also known as varenicline, at 33.2%. Then bupropion, also known as Zyban, at 24.2%. These numbers show that medication can be a powerful tool in your journey. Choosing the right option for you depends on several factors, such as your personal preferences, past experiences with quitting, financial considerations, or whether you have coverage for medications. Many people need to try a few different approaches before finding what works for them. In fact, it takes the average smoker about 7 quit attempts before they successfully quit for good. So, if one method doesn't work, it's not a failure. It's part of the process. You're learning what works for you. Remember, you're not alone in this, and every attempt to quit is a step forward. Reach out to your cardiac rehab nurse, pharmacist, or primary care provider for support. The important thing is, don't quit quitting. This sums up the smoking cessation medications available in Canada. If you have any questions or concerns, ask your cardiac rehab nurse, pharmacist, or primary care provider.